The other comment I hear is that, hey doc, this thing that CPAP, CPAP, continuous positive airway pressure, sounds like too uncomfortable. I don't want to wear it if I can avoid it. Well, most patients love it because that's what makes them feel great all day next day. And it's beautiful. The machines used to be big and bulky. Now they are so small. This is what the CPAP machine looks like. And there is a tube that is connected here. And the other end of the tube has either a mask which goes on the nose, but if you have claustrophobia, if you prefer not to wear that, then these nasal pillows, as we call it, they go in your nose like that, and you sleep with it all night long. It's pretty beautiful, trust me. So it's not uncomfortable. We can work with you to maximize the comfort so that you can maximize the alertness and you can maximize life. Other question I hear is, doc, I'm going out on a 4 or 5 day trip. Do I have to carry it with me? And I tell them, do you want to feel good when you're traveling, on vacation or on business? Or do you want to feel sleepy and tired? So if you want to feel good and alert, take it with you. It's pretty small. And most of the security guys who check these things at airport, those big guys, they already are using it. It used to be a problem in the past that they didn't know what this is. But you tell them that this is a sleep apnea machine, they will not bother you. I'll be happy to write you a note. So what else? The sinus congestion. Our nose is designed to let the air go in and out at normal pressure, not at increased pressure. So initially when you start wearing that machine, the mask, your nose behaves as if it's catching a cold. This usually improves by itself. Most newer machines have heated or cool humidity that moisturizes your lining of the nose. If you still have problem, talk to me and we can look into if you have dust mite or mold or any other indoor allergies, dog or cat, which can make things worse. We'll be happy to evaluate and treat you for that. There's a nasal spray. There are a couple of different kinds of nasal sprays you can use. One is nasal saline spray, which is over the counter. No medication, just salt water, sterile. And you use that 2 sprays each nostril 3, 4, 5 times, as often as little as you need. And there are some decongestant nasal sprays which are non-habit forming, non-addicting. It's called Atrovent, A-T-R-O-V-E-N-T, nasal spray. And as you remember, the correct way of using a nasal spray is look at your toes, spray your nose. So you bend your head, look at your toes, spray your nose, pointing towards the same side eye. That's how you get the most benefit. It doesn't drip as much in the back of the throat and gets most nasal lining and sinus lining treated. Claustrophobia. Doc, I have claustrophobia. I can't tolerate anything on my nose, on my face. There are beautiful nasal pillows, nasal prongs, nasal interface, which we didn't have 10 years ago when we started the sleep lab. So use them. Claustrophobia is no excuse for not getting treated for sleep apnea. So these are the common problems that we see. Now all the newer CPAP machine has a SPY card, compliance card, which tells me how long each night and how many nights a month you are using the machine for. If you want to maximize the benefit of wearing the CPAP, then you should use it at least 7 hours every night. Initially it might be 2 hours. It may take 6 months for it to get to 7 hours every night. But do it, please. Your brain deserves deep sleep. Your heart, your body as a whole deserves uninterrupted good deep sleep every night. So use it 6, 7, 8 hours every night. If you catch a cold and if it is terribly uncomfortable, call me, we can do something. You may skip wearing CPAP for a night or two unless you have a heart problem, because when you are struggling to breathe at night, your oxygen is dropping, your heart rate is going up, your blood pressure is going up. That's a perfect setup for your heart to start fluttering or precipitate a heart attack or angina or congestive heart failure or stroke. Not trying to scare you, but that's true. So talk to me and we will see what we can do to maximize the amount of usage for patients with heart problems and all other patients also. I tell them that use it every time. If you have opportunity to take naps in the afternoon, put the mask on, put the machine on, don't take even a nap without the machine. Now that brings me to another issue, which is the naps. If you take naps in the evening, that would deconsolidate your sleep at night. That would prevent you from reaching deep stages of sleep at night. So 15-minute nap at 4, 5, 6 p.m., 7 p.m., so tempting when you're tired, can rob you of your deep sleep at night. So don't do that. If you must, then just a 15-minute nap. I have a rule, 2:20 rule, that I tell my patients. No nap longer than 20 minutes and no later than 2 p.m. And then you'll still be able to sleep well at night. So these are some common questions that I get asked, and hopefully it would help you answer some of your questions too. Thank you.